Hello, I'm Dominic Hopka, and I'll be presenting my evidence-based practice project regarding visual unilateral spatial neglect in patients following a stroke. I am on the neurosurgery unit at Mayo Clinic, Rochester on the St. Mary's campus. The purpose of this presentation was to assess whether the NIHSS stroke scale or the stroke scale is sufficient in assessing patients following a stroke for all the deficits, or if there was something more we could be doing to assess for stroke deficits like visual, hearing, and sensation. Little background, I've cared for a handful of stroke patients or post-stroke patients on the neurosurgery unit. Also, I've had a clinical experience on the Gunderson Neuroscience unit, so something very similar to the neurosurgery unit at Rochester. A little more significance regarding it is part of the ratings were showing that the NIHSS stroke scale is not necessarily as reliable as it could be in assessing for deficits regarding like vision, hearing, and sensation. Also, not many people are diagnosed with unilateral spatial neglect, nor are they assessed for it. That's just a key piece. I have not seen a single patient that has unilateral spatial neglect charted following a stroke. And to me, vision and hearing and sensation is a very important role in providing quality care and for patients and helping them reach their highest level of rehabilitation. And then also that visual loss or visual changes related to unilateral spatial neglect can prolong hospital stays, as well as lengthen the time from the stroke to recovery. So like full recovery, the time to reach full recovery lengthens. The PICO question I have was comparing whether the unilateral spatial neglect assessment tools along with the NIHSS assessment tool were better than or more effective than the NIHSS assessment tool strictly on its own. Research strategies I just went through on CINAHL. I used neglect, stroke, and assessment. I wanted to understand the full encompassing effects of stroke and the potential for either caregiver neglect or, in this case, unilateral spatial neglect. Limitations I had were publications within the last 5 years, strictly English publications, and full text is available. Some major findings I had from my literature review was that there is an Apples test and a Bell's test for visual unilateral spatial neglect. In visual unilateral spatial neglect, the tests have patients find what the key phrase is. So for the Apples test, find apples on the scorecard, and you can see the scorecard in the bottom right. There's a QR code. If you scan that, it'll pull up what the Apples test is. And then the other one would be finding bells, and that is also in a separate QR code underneath on the bottom right saying Bell's test. Essentially what happens when people conduct these tests or assessments, they have patients mark off each bell or each apple that they find, and a positive indicator that they have visual spatial neglect is there will be a distinct line down the middle, or roughly the middle of the paper, in which one half has all or most of the objects crossed out, and the other half does not have the objects crossed out. And then another key thing was, as I had already stated, patients with undiagnosed USN may have prolonged hospital stays. They might have delayed recovery. They might have a poor self-image regarding their ability to care for themselves, because if they can't see or feel or hear properly, they might look negatively upon themselves, like, why can't I do what I did before? Why can't I see like I did before? Why I can't put my shoes on because I can't tell how I'm tying them or how I'm pulling them on. Just simple activities of daily living that we take for granted and that might have a severe impact on patients. The effectiveness of the tool was found to not really change depending on when you conduct the assessment. It could be immediately after admission or 72 hours after, and it'll still have a positive correlation or sign of whether you have unilateral, or that patient has unilateral spatial neglect at each given time. It does not matter what time you assess patients at. What matters is whether you do the assessment or not, because then you can identify those deficits related to the unilateral spatial neglect. And then the last key part of the findings was that the nursing practice is recommended to conduct unilateral spatial neglect assessments upon admission at 12 hours, at 24 hours, and at 72 hours during the hospital stay. Also, that more research should be pushed because there isn't really a whole lot of information regarding the other forms of unilateral spatial neglect regarding hearing or sensation. There is information regarding the use of virtual reality in assessing unilateral spatial neglect, but that's not something feasible for nursing themselves to conduct throughout their shift and throughout the hospital stay for those patients following a stroke. So something similar to like the evidence I found would be the recommendations for future practice would be the assess patients at admission 12 hours, 24 hours, and 72 hours following their stroke-related diagnoses. I'd also recommend that the nursing practice utilize the Apples test to assess for visuals unilateral spatial neglect, as it is a simple tool to use, but extremely effective and more beneficial to find and assess and diagnose this potential for unilateral spatial neglect, so we can then work with rehabilitation or rehab or PT, OT, physicians, just trying to promote that patient's quality of life and promote the healing process for those patients. I also recommend that more research be conducted for nursing, specifically to conduct assessments on unilateral spatial neglect. Like I said, there isn't a whole lot of publications necessarily available for the other forms. So maybe having either researching ways that we can assess hearing more effectively, like hearing loss or sensation loss. I know we can ask for numbness and tingling, but I don't know if that necessarily gets the full assessment that it needs. More of we document it, and I don't know that it goes further than us documenting most of the time. To conclude for everything here, like I said, if you want to check out the QR codes I have below, they pull up the different assessment tools that are used in assessing visual unilateral spatial neglect. Just keep in mind the Apples test was found to be more reliable. So if you were ever wanting to incorporate it into your nursing practice, or you want to be like, hey, I'm going to see if I have any deficits, that would be the tool to go to and utilize in the future. Also, I found that the literature review and all the information I compiled supported my evidence in the P code, just that we should utilize both the NIHSS assessment tool and the USN assessment tool to get an over-encompassing idea on the deficits related to a post-stroke diagnosis. Again, I cannot stress it enough that more information and more research should be gathered regarding unilateral spatial neglect, and I believe that we should push for the assessments within the nursing practice to kind of give our patients the best outcomes in the future and really advocate for their needs, because sight, hearing, and sensation are all very critical needs when we conduct our activities of daily living. If you want to look at my references, there they are. They are all on CINAHL in full text for you to read at your pleasure. I hope you really enjoyed this presentation. I look forward to hearing from you in the future. Thank you.